Welcome everyone, it's Nigel Giam here, the lead GP training program director for the St Mary's scheme, and we're continuing with our SCA successes. I'm so happy to have Lumin join us today. And actually, Lumin and I go back a very, very long way to the era of the sort of RCA
AKT,
and AKT. Oh my goodness. And actually, yes,
statistics.
yeah, and statistics. And actually, I also taught Lumen's spouse, the lovely Lisa, who's been qualified now for about six odd years. So time really flies, doesn't it, Lumen?
It does.
Oh gosh, and it's just so good. When I received your email about your SCA success, I was so overjoyed because you've had such a journey through GP training, haven't you? Why don't you tell the audience a little bit about your journey, and then we can sort of break down some of your top tips for the SCA and some of the challenges that you faced.
Yeah. Yeah. My name is Lumin. Well, group was like everyone to call me Lumin. And yeah, I did have a journey in GP. I told my trainers that they probably would write stories for me, stories of me for years to come. And yeah, it was a mind opening. It was eye opening. There was a lot of challenges that I didn't anticipate at all.
No.
I mean, I was in GP training for as long as 5, 6 years in GP
Yeah,
training.
it was a really arduous journey. I remember because I mean, obviously we got through the AKT and then it was the days of the RCA, which was a really tough exam, wasn't it? Because obviously patients aren't standardized. I know that really kind of knocks your confidence for six, but
Yeah,
you passed the SCA first time, which
yeah,
was amazing.
yeah,
Despite those challenges, because you applied, I suppose, some of the techniques that we learned through the
yeah,
RCA to the SCA, and in a way, it's a bit easier because it's a standardized exam, isn't it, as well?
yeah. And I think, well, a lot of what we're going to sort of highlight today about my struggles with neurodiversity, I think
Mm,
that was that was a big reason why I struggled to pass the RCA because
yeah,
the RCA requires a lot of organization,
yeah,
to do time recordings and still do your normal clinic
yeah,
consultations.
yeah,
I struggle with that. But the
yeah,
SCA, using a lot of the techniques that I learned the Mentor RCA course. I applied it straight away to the
yeah,
SCA,
yeah,
and yeah, I found it a lot easier.
yeah. And that's a really positive note because actually, I think a lot of trainees actually are diagnosed with neurodiversity as they go along because for a lot of trainees, failure only really happens during GP training. Whether it's the AKT or CSA, RCA, SCA. So maybe we can just share a few tips, and then I suppose I suppose some of your positive experience as you've gone through this journey. For from the data gathering point of view, what would you say your top game changer was for the SCA? How did you optimize your marks in that domain?
Well, for me, obviously for the RCA, we were looking at case priming, but
Mm,
for the SCA, you can still translate that into
yeah,
making a plan. So when you
yeah,
read the notes in your mind, you're still making a plan.
exactly.
And you're making a plan right there and then. So
Yeah.
what am I being assessed?
Yeah,
What, I think that's the key question. For every station, you have
yeah,
to ask yourself, what am I being assessed here for?
exactly. Yeah. Why am I being in this information? What
Yeah,
potentially might be coming through the door? And that's the nice thing about a standardized exam because they're not trying to fool you with the data gathering. They're giving you that information for a purpose to be used effectively in
absolutely.
context. So
Absolutely.
that's a really important point for everybody that actually the exam it starts as soon as you have those 3 minutes with the notes. You can't just be sitting there going, "Oh, I wonder what's happened." You've got to be much more strategic, don't you, with it?
Yeah. And obviously another tip that I also, carried on in even in my own day-to-day practice was sort of knowing my role in the patient's narrative, where
Yeah.
you come in the
Yeah.
patient's narrative. Because
Yeah.
there's that, I think you pointed out to me when we did the first few sessions that, and when you watch my previous RCA
Yeah.
recordings, you said, oh, you need to know where you're coming in because you can't
Yeah.
just start right from the beginning.
That's right.
Yeah.
That's right. You can't. You need to know your journey. So we always put the analogy of a car journey. You're getting into the car. The patient, though, is generally already waiting for you, and you need to know what's already happened before
Yeah.
you step into the driver's seat. So that kind of brings us quite nicely on to, I suppose, well, maybe we'll go for relating to others first, and then we'll go for clinical management because you know, how important is ICE in this exam and how you use it?
So one problem I always had was and I think a lot of IMGs also struggle with this,
Yeah.
is that we are so fixated on ice that it becomes robotic. It
Exactly. Yeah.
becomes, like tick box
Mm,
exercise.
mm.
And it was sort of getting out of that whole idea
Yeah.
and trying to make it conversational.
Yeah.
Like you're having a conversation with a
Mm,
patient. It has to be
mm.
natural. It has to be that flow.
Yeah.
And so for me, I tend not to be rigid. So I think that I did that for the exam.
Yeah.
If the patient, I sort of go where the patient wants me to go. I'm
Yeah.
led by the patient in that
Yeah.
initial first
Yeah.
few
Yeah.
minutes.
Yeah. Yeah. Yeah.
Yeah. And if it's appropriate at that point in time to establish the ice, then I go ahead and establish
Yeah.
the ice.
Yeah. Yeah.
Yeah. And it's
I
all
think
about
that's
listening to
absolutely right,
patients.
isn't it? You just can't because more often than not, if you just follow what the patient's saying and their cues, ice will often open up quite naturally,
Yeah.
actually. And then you don't have to force it, you don't have to over ice. You
Yeah.
have to just acknowledge it and use it to determine the direction of travel. And when it came to clinical management, then, because I suppose one of the big themes that we always talk about is, as you say, it's not just about going through the motions of ICE, it's using it, but then readdressing it as you
Yeah.
come into the management section. I found that when people are quite rigid, there's a tendency for them just to then forget about ICE and just focus on the diagnosis.
Yeah.
So what would your if you were saying to your colleagues who are having issues with this, what would be a game changer for clinical management?
Well, you talked about the AEE
Yeah,
mantra. I think that was something that I sang, in my head over and
yeah,
over again, and I sort
yeah,
of used it and practiced with it over and
yeah,
over.
yeah.
Um, so it's about acknowledging
Yes,
and using the information, the ice that you've already
yes,
elicited, empowering the patients
yes.
and empathizing. So
Absolutely. Yeah.
those three things was key
Yeah,
for me.
I think that you've got it because I think people often go, well, I said that, and my colleague said that, and he passed, and I failed, and it's not just about going through the motions of saying words. You
Yeah.
have to come with actually a sense that it feels sincere, that actually your tone, not just what you say, how you say it, and so we're managing patients and narratives as opposed to just symptoms and diagnoses. So I'm just really happy that you've nailed this because it is still a pretty tough exam to be fair. I mean the pass
Yeah.
rates for the SCA are really poor. I mean they haven't really sort of surfaced over 70%,
Wow.
since the inception of the SCA and I think a lot of IMGs and particularly those with neurodiversity are so fearful of this exam, but it is such an attainable exam if you've got the right mindset. And I suppose in this latter part of the interview just wanted to kind of move on and talk, I suppose, about some of the challenges that you had with your journey in neurodiversity and some messages that you could give to perhaps an audience who could relate to what you're going through. If you're an
Yeah.
IMG, if you've got neurodiversity, what would you be saying to our audience to inspire them?
Yeah, and that's a very good question. I actually found out because I think later on, just a few months before I CCT'd, I started a WhatsApp group and sort of invited trainees who are neurodiverse and got to ask them questions, got to interact, find out, where the common struggles, where are there other things that
Yes.
people might have talked about. And I think a lot of times is at the start of training, not many people come forward with their diagnosis because there's that fear
Yeah.
of being a lot for me, I was diagnosed with dyslexia later on in training, and then got diagnosed much later on in my ST3 with ADHD, more of the attention deficit.
Mm.
And one of the things that I realized that as neurodivergent trainees is that we tend to mask our neurodiversity. So
Yeah.
the effect of the whole concept of masking, just so that we can blend in and not
Yeah.
be seen as, lazy
Yeah.
or weak. And
Yeah.
I think just coming forward with it right
Yeah.
as earlier than that as soon as possible.
Yeah.
Like for me, if I had known before starting GP training,
Mm,
you
mm,
know,
mm,
that would have made a massive difference in how I structured my training. Maybe I would have
mm.
gone less than full time from the
Yeah.
beginning,
Yeah.
and yeah, and got that appropriate coaching, because at one point in time I got coaching, but
Yeah.
it wasn't the suitable coaching. I got the sort of
Yeah.
the generic coaching that
Yeah.
we all
Sure.
get.
Sure. Sure.
But that fine-tuned for for someone like me with
Yeah.
attention deficit, which my main problems were procrastination,
Yes.
and that, when you procrastinate the
Yeah.
e-portfolio, you're going to land yourself in big trouble. And
Yeah.
that's what happened with me. So
Yeah.
yeah,
Yeah.
it's getting that early support, getting that diagnosis early, and getting that
Mm.
early support. You
Yeah.
know,
Yeah.
I think for me, that if I were to go back and change things, that's
Change
probably
things
what I would
around.
have done.
Yeah. And I think that's such an important message, isn't it? Because people are so fearful of, I suppose, standing out or maybe having that label, but actually there are so many strengths also to
Yeah,
being neurodiverse, which I think people often don't see. And I teach a range of neurodiverse learners, and actually you can form very good working relationships if everyone's just open and communicative, from
yeah,
the outset. Really, I think what the tendency is the diagnosis often surfaces after a failure. So then what tends to happen is you're kind of almost starting off on a back foot.
yeah.
So this proactiveness that you talk about, I really like. But did you have a sense that, you were neurodiverse or a different learner even before, I suppose, all of this? Or is it only through GP training that and when you look back on it, I'm just interested in that reflection.
That's a very interesting question as well. Looking back, I always knew there was something different with me.
Mm,
I just couldn't put a finger on it.
mm,
Now, when I started GP training, obviously learning more about neurodiversity, about autism, ADHD, I still couldn't pinpoint, as in,
mm.
or put reflect it back to myself,
Yeah.
because I look back and I was never the hyperactive child. I was never
Mm,
the child in school where parents were called in because of problems.
mm, mm.
But it was only later on that I realized that as adults, the adult type ADHD, if you were
Mm.
to put it that way, a lot of that do not present with the hyperactivity sort
Mm.
of symptoms. And
Yes.
a lot of the symptoms are sort of subtle,
Mm.
and you might go through primary school, secondary school,
Yeah.
have a bit of struggle through university, but you'll
Mm.
get through that.
Mm,
But when
mm.
you start doing masters and postgraduates,
Yeah.
that's when it starts to bite.
Right. Right.
Yeah.
Yeah.
So for me, yeah, I knew there was always something wrong,
Mm.
but I just thought, okay, maybe that's just the way I am, and
Yeah. Yeah.
couldn't
Yeah.
really put a finger on it
Yeah.
until, yeah, I had my ADHD assessment, and I spoke
Yeah.
to the psychiatrist that did my assessment,
Yeah.
and yeah, opened my eyes to a lot of things that which I
Yeah.
didn't realize before.
So I guess, I mean, you don't, yeah. So I suppose one of the big things is you don't have to kind of wait to fall in order to get the necessary support. As a TPD, I would say if people can really relate to it, then just as Lumen said, actually, there's help out there, and actually the earlier that you can seek support, and know that you'll be supported, then actually you're going to get a very positive outcome. And you've had a fantastic positive outcome. I'm so happy, as I said, when I've got that email. Um, what's the
So
plan,
great.
Lumen? The world is now your oyster. No more exams, no more e-portfolio, no more SCA or AKT. What are you going to be doing with yourself?
Well, yes, I've done a lot of, reflection, and part of getting the support that I did, which included medications, but also specific coaching, it sort of, made me see GP practice in a different light. I mean, if you asked me this question 12 months ago, I would have told you, if I finish, I'll just hang my certificate and go do
Yeah.
something else with my life. But now, particularly in the last few months of my training, my GP training, I started to enjoy GP practice because I started to, find my own niche.
Yeah.
find my own ways of working. And
Okay.
I got great feedback, lots of patients, giving me feedback. And on my last day at the practice 2 weeks ago, everyone was crying.
Oh,
Yeah, I mean, it was really hard. It was really heartwarming to see that
oh,
sort of reception. I didn't realize people cared that
mhm.
much about me. The receptionists, the admin staff, the other doctors, everyone. But it was quite nice. I've sort of had it, thought about I've thought about things and how I can maintain that balance because that for me that's key.
Yeah,
Um, I do want to have a special interest in minor ops in dermatology group 2. So that's something I'm going to pursue over the next 18 months, no pressure.
brilliant, brilliant.
But yes, getting that balance of sort of doing between a salaried role and the out of hours. I think because the
Yeah,
out of hours actually suits me quite
good.
well.
Yeah,
Yeah,
yeah. I think it suits quite a lot of my trainees as well, actually. It's quite nice. It's different. And I think you've got to have that balance, not just in terms of work-life balance, but just, the balance within work. You've got to have things that
yeah,
kind of keep you enthused and passionate. And
absolutely. And
yeah,
I never saw myself as a, I mean, I never saw myself as a GP that would be doing like 8, 9 sessions. I
yeah,
had a colleague we trained together, and he's now at the practice,
yeah.
about to become a partner, and he does about 8, 9 sessions. But
Wow.
I
God,
think it's understanding your own strengths.
exactly.
That's the key. So I
Yeah,
understand my strengths, and I know this is not for me. This is what's for me.
yeah,
This is what works for me. Once you understand your strengths and your weaknesses, and you're able to, utilize your strengths to get the best outcome, that's when you get, job satisfaction and satisfaction in the
absolutely.
profession
Yeah,
as a whole,
yeah. No, I
and
think
not
it's such an
burnout,
important
which is
message.
something that I did quite a lot in GP
Yeah,
training as well.
yeah. Well, Lumen, I'm so very happy for you. Wise messages, play to your strengths, but don't be scared of your weaknesses.
Yeah.
I wish you the very best moving forwards. Regards to Lisa, and promise you'll keep in touch.
I will. I will.
Okay. All
Yeah.
right.
I mean, you started this journey. Well, you were influential in this journey. I remember I was when I was preparing for AKT, I was a bit terrified of statistics,
No.
and Lisa said, "You know what? Just go on Nigel's course, the statistics course. That's all you need for the exam." And
Oh,
I have been telling a lot of my trainee colleagues that, look, if you're struggling with statistics, I can recommend a course for you for statistics.
oh.
No,
That's
it's quite
very
brilliant course
that's
because
very,
it's sort of
very kind of you. To be fair, I'm trying to help my youngest daughter through her GCSE maths, and it's pretty bad actually for me, to be fair. But anyway,
yeah,
that's another story. So do keep in touch, and GP's a small world. If I can help in any way, just reach out.
I will. And
Okay.
thank you so
Take
much.
care. Thank you.
All
Thank you.
right. Bye
Bye bye.
bye.